My grandmother underwent one of the first interferon trials for chemotherapy here at Johns Hopkins when I was probably about 6 years old, and I will remember that forever. Johns Hopkins was the place that gave us hope. My name is Stephanie Fuller. I'm the Chief of Pediatric and Congenital Heart Surgery at Johns Hopkins, and I'm the co-director of the Blalock-Taussig-Thomas Heart Center. So I really operate across the spectrum of pediatric and adult congenital heart disease, meaning it's heart disease that you were born with. This includes patients as early as newborns, premature babies, and patients as they continue to age in adulthood. For example, patients with complex forms of congenital heart disease, like hypoplastic left heart syndrome, or having half a heart. And I think what we didn't anticipate 40 or 50 years ago is how these patients would age and how they would develop. So now better understanding that patients often need repeat operations as they continue into adulthood, as residui and sequelae of their original disease become prominent in adulthood. Congenital cardiothoracic surgery is just an incredible profession. It gives you the opportunity to not only save a life, but also create a life and provide a future for patients and their families. It's a combination of a very technically demanding field of surgery, together with an opportunity for lifelong learning. I think patients really are the why. They're why we do this. And one thing I like to say is that, we work for the patients, not the other way around. I think it's really critical that we do things to ensure not only that they have a good clinical result, but that we care for the whole patient. And in my career, that means patients who are going to grow up and hopefully become functional adults. They're going to be able to hold down jobs. They're going to be able to create their own families. And hopefully they're going to live a long and healthy and happy life with our help. My research focus has been on longitudinal outcomes of congenital heart disease. I'm curious and interested to know how we can improve the care for infants and children so that they have more successful lives as adults. Many of these patients have sequelae and residual disease or residual lesions that even mean future operations once they reach teenage years and adulthood. By better understanding and tracking how we treat these patients, we're hopefully better able to stratify them as children and deliver the appropriate therapy at the right time for each individual patient. Certain lesions that are of great interest to me are neurodevelopmental outcomes and how patients can live healthy lives, not only physically healthy, but also mentally healthy, and how we can then again conquer valve disease, one of the biggest challenges that we have in the pediatric population. One of the most important parts of my career is certainly teaching and mentoring. And I think what that does is it provides us with a little bit of a legacy. I know that I'll be able to do these operations for quite some time in the future, but my concern for my patients and for their families is who's going to be available to take care of them down the road. And so being able to work with residents and fellows and even medical students who have promising careers and have great interests is something that is just incredibly close to my heart. I don't think I would be here without the incredible mentorship I receive from many surgeons, both in congenital heart surgery, adult cardiac heart surgery, and even general surgery. In addition, in particular, I think it's important as a woman cardiac surgeon to make sure that I'm there as a role model for future women wanting to go into cardiac surgery. Johns Hopkins offers incredible opportunities, and they're across really three fields. One is the field of clinical excellence. The second is the incredible research base here. And the last is the individual talent and caring for each person here at Johns Hopkins. What this does is provide a unique opportunity to take patients from newborn or childhood all the way through adulthood. They can have a continuum of care that's individualized and tailored towards not only each patient, but towards their specific form of congenital heart disease. This is a unique opportunity here at Hopkins that I will look forward to every day.